Centers for Medicare and Medicaid Services are encouraging providers to implement Certified Electronic Health Records, or EHRs, which provide more efficient and coordinated healthcare to patients by offering incentives through the Medicare and Medicaid EHR Incentive Programs. Medicare incentive payments will be given to eligible hospitals and eligible professionals that demonstrate meaningful use of certified EHR technology. Medicaid incentive payments will be provided to eligible professionals and eligible hospitals that adopt, implement, or upgrade certified EHRs in the first year of participation in the program and demonstrate meaningful use for the remainder of the program. Cherokee Nation became the first tribe to receive an incentive payment from the Oklahoma Medicaid EHR Incentive Program for its implementation and use of EHRs at W.W. Hastings Hospital in Tahlequah, Oklahoma.
It is not the first time that we've been here with the Cherokee Nation and the Healthcare Authority celebrating the first in the nation, and that is the first tribally operated health system to receive the incentive payment, the federally funded incentive payment for electronic health records.
We're so thankful, and this acknowledgement is for something that's it's fundamental in using every tool available to us. The shared electronic health records gives everybody, the patient, the doctors, the system, a way to deliver more services at less cost, greater proficiency, and it's something we're very proud of our IT people, the hospital, the nation, and we certainly appreciate the partnerships we were able to do with the Healthcare Authority.
This is a great day for Cherokee Nation Health Services. We pride ourselves in being a leader in many aspects of healthcare, as Chief Smith mentioned, but we definitely have been a leader in electronic health record over the past few years, and this is just a fruition of some of those many efforts that our staff have done to improve the health care of our citizens.
The tribe started using electronic records in its 9 health centers and the hospital more than 7 years ago, but recently certified its system, enabling Cherokee Nation to become the first tribe to receive the incentive payment.
It helps in communication with other specialties and other services, and the fact that, one, first of all, you can read each other's notes. Number 2 is, I think there's better documentation and reminders for patient care that's needed at certain times with certain disease processes, that you're able to remember to ask the right questions and acquire the right labs for the patient.
By having an integrated system like we do, it allows to share the data between our providers, which speeds up access and also ensures the quality of care that we provide. By lessening the paper, there's less chance for medical errors.
Patients will receive better health care and safety of the health care that they receive because of the real-time access that the providers will have to the information about the patient's medical care. That will decrease duplication of services, because if someone has already performed that test, say 2 days ago, then today the provider is going to know that that test was already performed and they won't be duplicating that service.
The Medicaid Incentive Program really is the turning point for the provision of health care in this generation. It is just enough to invest that I think makes a difference between medical practices that are willing to make that transition to electronic health records. Vitally important, but they have to have a little boost financially to make that commitment.
The award to the Cherokee Nation demonstrates how partnerships and teamwork are necessary in improving quality of care through an EHR system.
It's a wonderful experience. Wonderful for the Cherokee Nation that we were first to be able to apply for these kinds of things. But it just goes back to the people that I work with really deserve the credit for this. They're the ones that, you know, figured out that this was something we'd qualify for, figure out that we could document well and get these kinds of incentives that were being offered.
It really takes the state and the tribe and Indian Health Service to all work together to work through those issues and be able to achieve the kind of payment that we were able to award today. We have a really good relationship with Cherokee Nation, and we really worked hard to be the first.
The Cherokee Nation will be eligible to receive incentive payments for the next 6 years by continuing to participate in the Medicaid EHR Incentive Program.
You know, today we celebrate an event with the electronic health records that represents the first in the nation. It's not the first time our partnership has created a situation that represents progress that's the first in the nation. It won't be the last, but it's a remarkable partnership that has many, many benefits for all of us.
For more information on how to enroll in the Medicare and Medicaid incentive programs, please visit www.cms.gov/EHR incentive programs.